Welcome everybody, this is Chris Hannafin from the Physician Assistant Program at Seton Hall. I'm the Program Director and I'd like to welcome you to our virtual open house that we'll be holding. I'm going to take you through some information about our undergraduate dual degree program, and that's kind of a unique program which affords really high-performing high school students the opportunity to be guaranteed a seat into the graduate end of our Physician Assistant Program. So with that, we'll move through the presentation. We usually start out by talking about what does a physician assistant do. We're relatively new in New Jersey and a lot of people aren't aware of our profession. Our profession started in the mid-1960s, and the person generally considered the father of our profession is pictured here, Dr. Eugene Stead. And he was a physician heavily involved in medical education at Emory University and at Duke University. And when he was working in North Carolina, he found there were large rural underserved areas, and he really had a heart for trying to reach out to the underserved, and he tried to figure out a method of providing healthcare providers to these folks. So he found that there were a number of folks in the local community, primarily ex-military medics, that had a very high level of training but were generally unable to find a position that would utilize that training. And he took these folks and developed the first physician assistant program. So that's a picture of the first PA class back in 1965. And they went on and graduated and worked in primary care medicine. And as time has gone on, PAs have branched out into basically every branch of medicine. So our heart is still very much in primary care, but we work in very technical fields, including pictured here is open heart surgery. And one of the places that makes the best use of us tends to be the military. They were very early adopters of the PA profession, and PAs have risen to very high ranks and have taken on very sophisticated responsibilities working in the military. Where do PAs work? Nowadays, pretty much every place. So places like Stanford and Johns Hopkins, the Mayo Clinic. There's even PAs on the staff that take care of the president and the vice president. If you're from the local area in New Jersey, you'll find PAs in every healthcare system here. So we work throughout Robert Wood Johnson, St. Barnabas, Meridian, Atlantic Health. We're pretty spread. Pretty much any place you would go in a healthcare setting, you'd find a physician assistant working there. But our heart is still very much in places like this. Our profession was designed to be the people that wanted to go places nobody else wanted to go, to take care of people that nobody else wanted to take care of. So we still have very much a heart for primary care, and we like working in underserved settings, whether they're in an urban area or a rural area. To talk about our dual degree program a little bit, we have what's called a 3+3 program. And the way this works out is students complete 3 years of undergraduate education, and if they maintain prerequisite criteria, they're able to track directly into the final 3 years of the program, the 3 graduate years of the program. So students are admitted into a dual degree track directly from high school. And one advantage of the program is the students are able to complete the entire program, their undergraduate degree and their graduate degree, in 6 years instead of the typical 7. So students are awarded a BS in biology degree at the conclusion of the 4th year of the program. What is the student's typical senior year, they come over to the graduate end of the program and take graduate level coursework. And then after completing 2 additional years of coursework at the conclusion of their 6th year, they're awarded a Master of Science Physician Assistant degree. Students who get admitted into the bio-dual degree program as a freshman are guaranteed a seat in the graduate program as long as they're able to maintain GPAs and meet other prerequisite requirements. One of the requirements is that students stay on track and complete each portion of the program in a timely fashion. So to be admitted into the program as a freshman, freshmen are required to have a 3.2 GPA, a 590 and 580 on their SAT scores, or we also accept the ACT test and they have to have a 25 or better on that. If students meet these requirements and they know they want to become a physician assistant or they're interested in the program, they can track directly into the program and they'll be guaranteed a seat if they continue to maintain high academic performance through their undergraduate education. In terms of financing and education, Seton Hall is pretty generous with scholarships and grants. The one nice thing about the dual degree program is the prerequisite requirements in terms of grade point and to stay in it are fairly high. That usually means pretty much automatically students who are in the dual degree program and remain in good standing usually receive a pretty generous packet in terms of financial aid. So students automatically are considered for merit-based scholarship basically in the admissions process, and when you received an acceptance letter, you'll receive additional information about what kind of package has been awarded to you. Our undergraduate coursework looks pretty much like typical pre-medical undergraduate coursework. So our students take a year of general chemistry, a year of general biology, statistics, intro to psychology, microbiology, and anatomy and physio, a year of that, anatomy and physio 1 and 2. And the science courses have laboratory sessions included with them. In terms of accepting AP credit, we do accept AP scores of 4 or higher. The one thing we can't accept is courses in our prerequisite coursework. So if you're planning out your curriculum and you're trying to decide which type of AP courses you want to take, it's generally in our interest to take things that would turn into electives later on, things like English and history, ethics, and philosophy. If you take prerequisite courses as AP courses, you can transfer the credits in. That might loosen your load a little bit, but we will require you to repeat the courses in-house, but just because we want to be ensured of the quality of the coursework and to make sure you're adequately prepared to do well in PA school. If you're part of a high school program that allows you to take college-level coursework as part of your high school curriculum, those grades are also accepted as transfer courses. It just needs to be documented somewhere on a college transcript that you have received a letter grade for that coursework. In terms of mentorship, our students receive an advisor throughout the course of the program. So during the freshman year, there's dedicated freshman advisors that help students make the transition to college. After freshman year, if students are still interested in remaining in the dual degree track, we have our own advisor within the School of Health and Medical Sciences that works with undergraduate students and helps maintain them on track and make sure they're keeping up with all the requirements. And then when students transition into the graduate end of the program, they're assigned one of the core physician assistant faculty members to function as their advisor through them getting their Master in Science degree. Our faculty throughout the program, undergraduate and graduate, are very accomplished scholars. They're researchers. At the undergraduate level, students have a lot of opportunities to get involved with research and other activities with the faculty, so we really take a great deal of pride in working closely with our students, and we consider the close and careful instruction of our students one of the most important things that we do. To maintain good standing within the program, students' academic performance is evaluated on a regular basis, and typically grades are scrutinized at the end of each academic year. Dual degree students, in order to maintain their guaranteed seat, are required to have cumulative and prerequisite GPAs of 3.5 at the end of each academic year. They have to earn a grade of B or better in all of their prerequisite courses. And sometime before the conclusion of junior year, they're required to document a minimum of 250 hours of healthcare experience. There's a wide variety of experiences that are acceptable. It can be paid experiences, so we encourage students, if you're able to find a paying job in a healthcare facility, by all means go ahead and do that. Sometimes students will seek to volunteer as an emergency medical technician, maybe with a local first aid squad. They can volunteer in a hospital. Some students will just shadow in a healthcare setting with maybe their physician or with an emergency medicine program or some other program that a hospital has. So we're able to accept a very broad number of experiences for this. We're just hoping that the first time students set foot in a hospital is not when we send them there. We want to make sure they know what they're getting themselves into in terms of a career in healthcare. For admission into the graduate end of the program, one notable thing is the GRE examination is not required, so students who are on the dual degree track can come into the program without taking the GRE. If you are able to get into the dual degree program, I would encourage you to do everything possible in your power to stay on the dual degree track. Admissions to PA school right now is very, very competitive, on par with admissions to medical school. Many schools participate in a centralized application service, which causes them to receive something like 2,000 applications a year. So you can see it can be very difficult just in terms of statistics to get into PA school well. All of the requirements for PA school, all of the coursework must be completed by the end of the junior year. If a student finds themselves unable to stay on the dual degree track, basically what happens to them is they fall back into a regular biology major, and they would find themselves in the position of needing to apply to PA school at the conclusion of, at the normal time when everybody else would be applying for PA school. So if you do fall out of the PA track, it does not necessarily mean you're never going to be a PA. It just means you're going to find yourself kind of in the general applicant pool, where it's a much larger pool and much more competitive to get into PA school. In terms of the graduate coursework, students in the dual degree program begin their graduate coursework in the 4th year of the program, what would be your senior year. The coursework at that point repeats a lot of tough basic science courses. So you took anatomy and physiology typically in your junior year. You'll repeat those courses at a higher level in addition to things like pharmacology. There's also a great deal of hands-on instruction that takes place. Up to the extent of about 9 to 12 hours a week in a lab is spent practicing hands-on skills. And one thing PAs really pride themselves on is really having good history taking and good physical diagnosis skills. So you'll find we spend a lot of time on that. So that's kind of the first year of the professional end of the program, what would be your senior year. At the conclusion of that year, you graduate with your undergraduate degree or Bachelor of Science in Biology. You walk at graduation, you do all the usual senior week events, so you do get to enjoy all the typical stuff you would enjoy as a senior in college. And then the following year when you come back, that's when we start to begin our clinical experiences. So years 5 and 6, most of what students spend their time doing, on the order of 40 hours a week, is rotating through different clinical settings. And you can see there's a picture here of a student in surgery. They expect you to perform at a very high level. They expect you to jump in, to know what you're doing, and really get your hands dirty on these rotations. We've had the opportunity through the years to offer some unique clinical experiences. The picture on the left here is a student who's doing an open heart surgery elective, and the team came to him one day and said, "We're going to be going to harvest a heart from a donor so that we can do a transplant. Are you interested in coming with us?" This was an opportunity this student made happen for himself. I didn't do this, and Seton Hall didn't do this for him. He did this by showing up early, staying late, and really being enthusiastic. And that's actually a picture of him bringing the donor heart up into the operative field for the transplant. The picture on the other side, the young lady looking through a microscope, that's a student doing an overseas rotation. We have a number of contacts in the Philippines, and the Philippines is a nice place to rotate. The clinicians over there have really exquisite physical examination skills. They don't have the same kind of resources in terms of fancy testing and MRI and things we can do here in the United States, and that causes them really to have sharp history and physical examination skills. So we are able to send usually about a half dozen students overseas to Manila and outlying areas a year, and it gives them the opportunity to see the challenges of providing healthcare in kind of resource-poor environments, and it's really been an eye-opening experience for our students. Another thing that's a little unique about our program is we afford students the opportunity to actually conduct a research project. A graduate degree, one of the implications of that is you've gained some research experience and you've gained some competence in performing research. Many EPA programs will just have you kind of perform something along the lines of a literature review. We actually ask our students to design a study, collect data, analyze it, and present their conclusions. And what you see here are a couple of articles from the Journal of the American Academy of Physician Assistants. After you graduate from PA school, there's usually a lull of a couple of months where you're waiting to take your board exam and waiting for your license to come through. We've had the opportunity through the years to ask our students, we've come to them and said, "Hey, you wrote a pretty good research project. If you're interested, this is probably publishable." And every once in a while, a student will take us up on that opportunity. And this is something that can really make your resume look sharp and make you stand out from other folks that might be applying for jobs you're applying for. One big change that took place in our program last year was we made a major transition to a new state-of-the-art campus over in Nutley, New Jersey. It's called the IHS campus, for Interprofessional Health Science Campus. All of Seton Hall's allied health programs moved over there, along with the College of Nursing, and also in the building is the Hackensack Meridian School of Medicine at Seton Hall University. And we had the opportunity before we moved over to this campus, we worked with architects and curriculum planners for about 2 years, and they asked us, what do we want this facility to look like? And it's really been a dream come true for us. One thing that's a little different about many of the classrooms is they're oriented towards group work. So instead of forward-facing seats like you'd see in many typical classrooms, a lot of the classrooms are oriented towards having students in 8 groups of 8. And the delivery of healthcare is very much a team endeavor these days, so it's important you learn your teamwork skills. And there's a lot of technology involved. You can see here each table has their own monitor. We're able to take whatever students put up on one monitor, share it across the room, and we can really get a lot of group work done, and we can do a lot of case-based learning and problem-based learning using the facility. The facility also has a state-of-the-art anatomy lab. It was a great pleasure moving into here. For the first time when we moved into this facility, our students were able to do complete dissections as part of their anatomy. Prior to moving into this facility, we had the instructor do prosections. Here, the students are able to do all of their own dissections, and that's been working very well in terms of our students getting a great knowledge of anatomy. The facility also has a lot of simulation space. So this is a picture from the standardized patient suite. We have a 16-room area in the building that's set up like 16 examination rooms that you'd see in a typical physician's office, fully functional. The rooms are equipped with cameras that allow us to record student-patient interactions, and our students can practice with their classmates in here, and we also have a team of about 60 actors that function as standardized patients. They can portray different medical conditions, and the other nice thing they can do is they can also portray different emotional states. So if we want them to pretend like they're angry because they've been waiting in the waiting room for 2 hours to be seen, they're able to portray that well. If it's someone that you're delivering bad news to and you want them to become emotional and cry, they can also portray those states very well. So it affords us the opportunity to give a very realistic simulated patient encounter. And the nice thing about this environment is instead of the instructor giving the student feedback, we can actually record these interactions and ask the student to review it and say, what do you think went well and what do you think didn't go well? And that really affords the student an opportunity to develop a lot of insight into their patient interaction skills. Another part of the building is devoted to high-tech patient simulation equipment. So simulation mannequins. We have a simulated operating room you can see here. So there's actually a SimMan mannequin on the operating table there. Extremely realistic. When they breathe, their chest goes up and down. You can hear heart sounds on them. You can hear lung sounds on them. They can have tears. They can sweat. They can do a great deal of interactions. It really provides us the opportunity to put students into what would normally be a high-stakes environment if the first time they saw it was in a clinical setting. We're able to run them through evolutions on the campus, and there's a number of different rooms set up. This is set up like an operating room, but we also have a critical care environment, typical hospital rooms, a pediatrics room, and labor and delivery. So this affords us the opportunity for students to see really high-stakes stuff in a low-stakes environment. And the nice thing about these rooms as well is everything that goes on in them can be recorded. We can stream it live, and other students can watch and comment in real time as their peers are going through cases, or we can record all of these and sit down with students after the case and try and decide what went well, what didn't go well, and what can we improve on next time. So again, it allows us to give students really a great deal of feedback. In terms of program outcomes, one thing all students worry about during their PA education is how they're going to perform on the PANCE, the PA National Certifying Examination. All PA programs are required to post their last 5 years of scores for the PANCE examination, so these are our scores. You'll see they've run from 96 to 100%. The 96 generally represents one person in a cohort not passing the PANCE. All of our students who haven't passed the PANCE on the first go-around, you have the opportunity to take it again 90 days later. They've all passed on their second try. So everyone who's graduated from Seton Hall and taken the PANCE has become a practicing PA. And you'll see on the bottom line there, our 5-year first-time average pass rate for the program runs 98%. Just to put that in context, if you look at the U.S. News World Report ranking of what are considered widely to be the top 10 PA programs, you'll see their rates run from 96, 100%, 94%. Seton Hall at 98%, we're right up there with the best of them, and we can hang with any program's curriculum in the country. So we're very satisfied that our curriculum does a good job in preparing students for practice. In terms of employment outlook, it can vary a little bit in different areas of the country. PAs are very new to New Jersey. We were actually the second to last state to license PAs. We didn't get licensed in New Jersey until 1992. So we still find ourselves in a situation where the job market here is opening up. It's projected by the Bureau of Labor Statistics that nationwide there's a need for about 30% growth in the PA profession for the next 10 years. And they've probably been saying that for about the past 10 years. So we don't really have formal programs to place our graduates in jobs because we have not yet experienced anyone having a hard time finding a job. In terms of salary in the local area, most folks out of PA school, what we've seen over the past few years, it can vary widely depending on the setting and where exactly you're working, but most graduates will be offered an initial job out of school somewhere in the range of $90,000 to $100,000. You could potentially make more than that working in a surgical subspecialty in a place like Manhattan. You could potentially make substantially less than that working in a rural area, someplace, South Jersey or Pennsylvania, somewhere in the local area. So your salary will vary depending on your setting and your specialty. But what we found is it will always provide you a comfortable living for the environment that you're going to be living in. That pretty much concludes our presentation. You'll find we have a website that has pretty extensive information related to the dual degree program, so you're invited to look at that. Just when you look at the website, make sure that you're looking at the one related to the dual degree program and not the general applicant graduate only PA end of things. But you can find information on there related to PA school, and we're also happy to provide any information. So our contact information is on the website. If you have any questions, I wouldn't hesitate. You can email me, you can call me. We can put you in contact with the undergraduate end of the program, and they can answer a lot of your questions about the undergraduate experience. And I'm very happy to try and answer questions about the transition up into the graduate end of the program, what the graduate program is like, and what our students have been doing since graduating. So thanks very much for your attention. Again, if you have any questions, please don't hesitate to drop us a line. Thank you.